The Doctor's Journal is brought to you by O Snacks and Medical Associates Hospital.
Do you know what a PSA test is?
No, for this I don't know about that.
PSA is not anything what's in the organization, what's in was in charge.
Do you know what a PSA test is?
No.
PSA test?
Yeah.
That is test or something?
Have you ever done a PSA test?
No.
PSA, no, I think public service announcement. That's what I get when I see PSA.
Welcome to the Doctor's Journal. So as you may have seen in our introduction video, we took to the streets of Trinidad to find out what exactly is the general consensus where it concerns men and their knowledge of prostate cancer. We will share some more of the responses later on in this episode, but the biggest takeaway is that most men we approach did not know much about prostate cancer or how to get screened.
And this is quite crucial as research shows that as much as 1 in 8 men will be diagnosed with prostate cancer in their lifetime. And the risk is greater of people with African descent, especially here in the Caribbean and in America.
In this episode, we are going to review the signs and symptoms of prostate cancer, screening and testing, as well as the treatment options available to you and your loved ones.
But first, let's find out more about the prostate, shall we?
Definitely. So the prostate is a small gland. Think of the size of a walnut, which sits just under the bladder and in front of your rectum. The cells in your prostate produce fluid that preserves and guards your sperm and controls your urine. In other words, the prostate's main job is to help produce semen, the fluid that transports sperm.
Now, when these cells begin to grow out of control, however, it can develop into prostate cancer. Early stages of prostate cancer don't usually cause any symptoms, but that's why it's important to know about your risk.
It's also important to note that some prostate cancers grow slowly, and as such, many men diagnosed with prostate cancer may never need any treatment. But there are some that grow quickly and are more likely to spread, and as such, will need medical intervention.
But how do we know when you are at risk or when screening should take place, right?
Prostate cancer, if detected early, is a curable disease. A man's risk factors must be identified upon consultation. These include a family history of prostate cancer or any cancers, medications such as 5-alpha reductase inhibitors, which may halve your PSA, or being Afro-Caribbean, and exposure to toxic chemicals. Men with these risk factors should begin screening at the age of 40 years old. Conversely, men without these risk factors should start screening at the age of 45 years old. Over the age of 75 years old, screening should be performed on gentlemen who have a greater than 10-year life expectancy. A prostate biopsy is a technique where the prostate tissue is sampled and sent to the lab for histological analysis. The prostate is numbed using local anesthesia, and then using an ultrasound, the prostate is divided into zones. Tissue is taken from each of the zones and sent for analysis. An MRI can be used to further increase the accuracy of the biopsy. There are 2 ways to perform it, transrectal or transperineal. Men don't delay, get screened and get checked out.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.
Every year, over 145 million persons seek out the emergency room, most admitted due to ongoing medical conditions. Here on the Doctor's Journal, we aim to fix that by addressing the most prominent and devastating medical conditions faced right here in the Caribbean. And your product can help. If you or anyone you know has a product or service that you would like featured on the Doctor's Journal, contact us today at 266-SGPS. That's 266-7477, or email us at marketing@sgpstudios.com.
Welcome back to the Doctor's Journal. Before the break, we talked about what prostate cancer is and the signs and symptoms to look out for. But what comes next? Dr. Mike had the opportunity to talk to some of our viewers to find out what they know about prostate cancer and the PSA test. Here's what he found out.
Do you know anything about prostate cancer?
The way thing I know about the prostate is that, well, you know, that's cause the flow of the urine to restrict it.
Do you know anything about prostate cancer?
Well, I know that how they check it. I have an idea how they check it with the gloves and that kind of thing. So.
Right.
I know some you should check for once you cross maybe 40s, maybe once a year. Other than that, I don't know that much about it.
The prostate enlargement is a problem where when a man gets it, it's hard for you to pee. And when you are going to pee too, sometimes you can't pee as how normal the pee comes. It takes sometimes every 5-10 minutes or even 30 minutes you pee small. So when you are peeing, you feel very pain.
Have you ever had a PSA test done?
This is the first time in Trinidad I heard only from you, right?
How old are you now?
Me, 22.
22, right. So you're young, right? So you don't need that test yet, right? But as you start to go up in age, you know, when you reach around 40 or so, you have to start thinking about screening because men have a higher risk of catching prostate cancer as the age advances.
PSA test, is that with prostate?
Yes.
Okay. I did. Funny enough, you said that. My family has a history of prostate cancer. So I know it's very critical to get checked ever so often. And I urge everyone who either have a history or as a male, they should get checked out their prostate. Apparently in my family, it ran my great-grandfather and my grandfather both passed away, unfortunately, God rest their souls, from cancer, prostate cancer. So I know this is, it's critical. So I myself went in and unfortunately, as the doctors told us, you should get checked out when you're around 40 to 45. That's the time you want to get checked out. So I was a bit young because I'm only 37. So with that said, I just was like, okay, let me pass back in 10 years. But other than that, I know it's very important for every guy to go and get their prostate checked.
What do you know about prostate cancer?
It's more prevalent in African males, higher age. Yeah, not too much. The PSA levels are usually increased in prostate cancer, and you could probably tell by a digital rectal exam.
So the prostate is a small gland located underneath the bladder. And if it's enlarged, it could actually restrict the urine tract from passing urine, and you could have different symptoms from that. A PSA test is prostate-specific antigen. It's a test that is used for screening for the presence of prostate cancer.
Prostate-specific antigen is a protein that naturally occurs in the blood. The protein is produced by both normal and malignant or cancerous cells of the prostate gland. The PSA test is a simple blood test that is sent to the lab for analysis, and it's an important tool in the screening process. The results are usually reported as nanograms of PSA per milliliter of blood.
While the general guidelines for recommended screening start at age 55, you may need PSA screening between the ages of 40 and 54 if you have at least one first-degree relative, such as your father or brother, who has had prostate cancer, or have at least 2 extended family members who have had prostate cancer. Finally, if you're of African descent, this ethnicity has a higher risk of developing more aggressive cancers.
Screening for PSA, though, Dr. Mike, is not complete with just a PSA. Yeah?
Guys, we need to touch on a very sensitive topic. We must address the DRE, or formerly the digital rectal exam. This is a completely normal part of the prostate exam, and it doesn't make you less of a man. It is very short and simple. The doctor can actually feel the prostate for texture, abnormalities like enlargement, irregularities, or nodules on its surface. Remember, guys, you don't want to become just another statistic because of fear of this test. Further testing will be performed if your doctor sees it necessary. These can include an ultrasound, an MRI, and/or collecting tissue from the prostate.
The good news is the prostate cancer survival rate is great if detected early. For some men, no treatment may be needed, but this does not mean that your cancer cannot progress. Continuous screening is always recommended with higher PSA readings. Don't go anywhere, we'll be right back to discuss more treatment options available to you.
Nandini Samuel, a registered dietitian, and today we are going to be speaking about the benefits of pumpkin seeds. Bioactive chemicals found in pumpkin seed, which are typically regarded as agricultural waste, have fascinating nutraceutical qualities. The elements zinc, phosphorus, magnesium, potassium, and selenium found in pumpkin seeds make them a nutritional powerhouse and a weapon in the battle against illnesses such as arthritis, diabetes, inflammation, and even prostate cancer. Pumpkin seeds have been investigated in various research for its anti-cancerous properties. Adding pumpkin seeds to your overnight oats, homemade granola, wholemeal breads, even soup, salads, and rice can add value to your meals. Today we will be preparing a healthy overnight oats recipe. So we are going to add half cup of rolled oats into the mason jar, half cup of milk, preferably low fat or almond milk, 1 tablespoon of pumpkin seeds, 1 tablespoon of chia seeds, 3 tablespoons of 100% natural peanut butter, 1 tablespoon of coffee, and this is optional for the coffee lovers, half teaspoon of cinnamon powder, and we are going to mix this and leave it overnight. And in the morning, it's going to be very creamy, all put together and easy to eat and serve.
Sneezing, sniffling, scratching? Reacted to your favorite food? Think it might be allergies? We at Allergenics provide personalized diagnosis and treatment for food, drug, contact, and aero allergens. Call us today at 480-4362.
Eat healthy and stay positive with O-Snacks Omega 3. Enjoy almonds filled with vitamin E, healthy fats, and fiber. Walnuts may decrease bad cholesterol, lower blood pressure, and provide diabetic support. Amp up your vitamin B1 with pecans. Pumpkin seeds are rich in iron, protein, and zinc. Dried cranberries are an antioxidant, heart-healthy superfood. Boost your immunity with Omega 3 Mix. O-Snacks, a healthier choice.
The best birthday gifts are at dbesttoys.com. Shop for the best brands you love at the best prices. Like VTech, Leapfrog, Fisher-Price, Play-Doh, Hot Wheels, Barbie, Cocomelon, LOL, Baby Alive, Crayola, Lego, Nerf, and remote control vehicles, kids learning desks and educational toys, ride-ons, bikes, drones, science toys, and board games and puzzles, and a wide range of baby items. We also have the best devices for school, like laptops, the Amazon Fire 7 tablet, the Amazon Fire 8, 10, and Kids Edition tabs, as well as cases and accessories. Visit us in-store at Forces Flagship MacBean. Shop online now at dbesttoys.com. No credit card required. Free delivery throughout Trinidad and Tobago on orders over $300. Cash or links on delivery. Order via call or WhatsApp at 32DBEST to order. And remember, we have the best toys at the best prices.
Welcome back to the Doctor's Journal. Before the break, we promised to share with you some of the treatment options your doctor may explore if you have been diagnosed with prostate cancer.
Now, different treatments may be recommended for each stage of prostate cancer. Your doctor will work with you to develop specific treatment plans based on your cancer stage and other factors.
Today, we have with us a guest, Dr. Sitahal, who is a renowned urologist. So, Dr. Sitahal, what has your experience been here in Trinidad and Tobago regarding prostate cancer?
The Caribbean male, and that includes the Trinidadian male, is very hesitant to be assessed by a medical practitioner regarding any prostate cancer issues. The prostate is a sexual organ, and that in itself brings a lot of caution regarding seeing a doctor. And the treatment and the assessment involves a digital rectal examination, which most men shy away from. So men typically would present in a later stage of disease in the Caribbean.
Okay, so what should men be on the lookout for prostate cancer? What would clue them in that they would have prostate cancer?
So in its earliest form, prostate cancer is totally asymptomatic. Screening is the only thing that would clue a medical practitioner in, and this involves a blood test and the digital rectal examination. As the disease progresses though, men can expect some blood in their urine, trouble and inability to pass urine. Then as the disease progresses further, there will be spread to the bone, causing bone pain, and this was one of the most common reasons for diagnosis of prostate cancer historically.
Wow.
And then lots of weight loss.
So essentially you're saying that the bone pain is something that pointed in the direction of prostate cancer in certain populations.
So in certain instances it can be. And as we get older, we tend to blame pain in our bones on osteoarthritis or any of the other diseases.
Just getting old.
Exactly, without actually cluing us into prostate cancer. And that's why we do need to have an assessment by a doctor at least yearly.
So what are some of the barriers that you may have encountered or you think that we should be aware of when it comes to screening and prostate cancer?
Well, urging the Caribbean male to come in to see a doctor is the first barrier. A lot of the times my patients' wives who bring them in and force them to see a doctor, or they come in for inability to pass urine, and literally, as we say in Trinidad, water is now more than flour, and you really do need to see a doctor. Other than that, the barriers are to diagnose prostate cancer after the rectal examination and the blood test. There needs to be an endorectal ultrasound and biopsy, which is an ultrasound probe into the man's back passage where we take out 12 pieces of the prostate. Men are very unwilling to have this procedure performed.
So in Trinidad and the Caribbean, what are treatment options available?
Oh, we have very internationally recognized treatment options.
Good to hear.
When it's confined to the prostate, there are 3 general treatment options. This is removal of the prostate, called a radical prostatectomy, seeds implanted into the prostate, radiation called brachytherapy, and also radiation from the outside come in called external beam radiotherapy. The doctor may also choose to add a radiation therapy with injections to the abdomen every 3 months for either 1 to 3 years, depending on if you don't have spread, or if you have spread, they may choose to do it lifelong.
Our audience out there may be asking, what can I do? What is the best advice you can give to those who are, at risk for prostate cancer or think they may have family members who are at risk?
My best advice would be to urge them to have screening by any medical practitioner. It literally involves a blood test. You can choose to skip the rectal examination if you so choose, but for Afro-Caribbean men, at least start at the age of 40, Indo-Caribbean men at least 50. If you have a family history, every year for at least until 70 to 75.
Wow. Well, thanks so much, Dr. Sitaha.
Before we dive into changes that you can make within your diet, we'd like to take a quick break.
Don't go anywhere.
Prostate cancer, if detected early, is a curable disease. A man's risk factors must be identified upon consultation. These include a family history of prostate cancer or any cancers, medications such as 5-alpha reductase inhibitors, which may halve your PSA, or being Afro-Caribbean, and exposure to toxic chemicals. Men with these risk factors should begin screening at the age of 40 years old. Conversely, men without these risk factors should start screening at the age of 45 years old. Over the age of 75 years old, screening should be performed on gentlemen who have a greater than 10-year life expectancy. A prostate biopsy is a technique where the prostate tissue is sampled and sent to the lab for histological analysis. The prostate is numbed using local anesthesia, and then using an ultrasound, the prostate is divided into zones. Tissue is taken from each of the zones and sent for analysis. An MRI can be used to further increase the accuracy of the biopsy. There are 2 ways to perform it, transrectal or transperineal. Men don't delay, get screened and get checked out.
At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure or optimize your health with one of our expert doctor consultations and diet and fitness plan. Call today at 282-2262.
The best for your baby is at thebesttoys.com. From the best strollers, car seats, baby carriers, high chairs, booster seats, rockers, jumpers and bouncers, walkers, baby blankets, feeding accessories, bathtubs, gyms and playmats, playpens, cribs, baby swings, changing tables, diaper bags, clothing and accessories, and the widest range of educational toys. We carry Infantino, Dr. Brown, Avent, Graco, Chico, Fisher-Price, VTech, Leapfrog, Disney Baby, Delta Children, Medela, and Twist Shape. Visit us in-store at Forces Flagship McBean. Shop online now at thebesttoys.com. No credit card required. Free delivery throughout Trinidad and Tobago on orders over $300. Cash or links on delivery. Order via call or WhatsApp at 332-BABY. And remember, we have the best toys at the best prices.
Are you looking for a customizable studio space with green and white screen cyclorama and professional production equipment to carry out your next big project? SGP Studios is the perfect fit for you. TNT's largest studio space with an overhead lighting grid and sound treated, perfect for television commercials, music videos, television programs, social media content, and film productions. We also have a wide range of production equipment available for rental. You can choose from a selection of Netflix approved cameras, modern lighting equipment, professional audio gear, 40-foot and 20-foot cranes, gimbals, drones, lenses, action cameras, and more, all at competitive prices. Whether you need a high-end cinema camera for a feature film shoot, specialized lighting equipment for a music video, or audio gear for a podcast, we've got you covered. And with our easy online booking system, you can reserve the gear you need in just a few clicks. Check us out online at sgpstudios.com.
Welcome back to the program. Today we are dealing with our men and we are talking about prostate cancer and what we can do to help prevent and treat this disease. We know that diet plays such an important role in our overall health and decreasing NCDs. So we had to step into the kitchen to see what nutritional tips Jeremy Bellamy has in store for us.
Absolutely. Hi, Dr. Mike, and hello to everyone at home. Now, research has also found that a healthy diet may reduce the risk of developing prostate cancer and possibly prevent or delay prostate cancer progression. Now, ideally, a plant-based diet would be what the guidelines recommend for prostate cancer. So, we are going to focus on that today. Always on the list is
fresh produce.
Absolutely. That's right. More specifically, you want your diet to be rich in fruits and allium vegetables like onion, garlic, beta-carotene-rich veggies like carrots, cantaloupe, right? Cruciferous vegetables like broccoli and cabbage. Also flaxseed. Lycopene-rich vegetables and fruits like tomatoes, as well as soy. And we also want to boost our fiber intake filled with beans, legumes, nuts, seeds, and whole grains.
I know this is going to be very tough for some of our viewers, especially the big meat eaters. How can they still get their protein in?
Well, we want to include lean protein with every meal. So, as a good substitute, we could aim to include plant protein like soy products, for example, tofu, some beans, lentils, chana. As well as, you could still have meat, but you could just limit the frequency and the portions. So like fish, skinless poultry, and those things could still be a part of your diet.
So we're not following Sparrow and saying, I never eat a white meat yet. Skinless chicken breast and turkey.
Exactly. And you know, we also have to be careful with our fat intake, right? So you want to recommend choosing healthy fats, cooking with extra virgin oil or even nut oils.
Now, this goes great on salads. Yeah. And avocado, one of my favorite healthy sources of fat.
We recommend choosing whole grains as much as possible. And they actually gives us some options like quinoa, brown rice, whole wheat pasta. Those are a few options. We also encourage you viewers to do what? Drink a sufficient amounts of water, at least 8 cups of water per day. And your body will thank you for it later.
Okay, Jeremy. So now that we talked about their go-to diet, what should our viewers try to remove altogether?
1. The amount of sugar they consume. This includes drinking sweetened beverages. Very important. 2. The consumption of alcohol. You want to limit to 2 or less, 2 or fewer drinks for men every single day.
So Jeremy, is meat off the table altogether?
I'm glad that you asked. Meat, dairy, eggs, fish, seafood, those things could still be consumed, but should make up just a small portion of the total food. Understand? Like, for example, the ideal plate could be filled with 1/4 of lean protein sources, right? Half vegetables and fruits, 25% or 1/4 fiber, carbohydrates. Healthy fats are also a very important component. At least 1 serving should be included each day. So for example, 1 ounce of nuts, 1 tablespoon of olive oil, and 1/3 medium avocado in your diet for the day is pretty ideal.
Emergent science indicates that a lifelong commitment to a plant-based diet may lower a man's risk of developing prostate cancer. Research is still ongoing, but we know a healthy lifestyle and diet certainly is a step in the right direction. Thank you, Jeremy.
Anytime, Dr. Mike.
Prostate cancer does not need to be a death sentence. And in some cases, especially when caught early, it requires little to no treatment.
Don't be another statistic. Go get screened. I'm Dr. Sunarine.
And I'm Dr. Mike. Thank you for joining us on the Doctor's Journal, where we help you track your health.
For more on prostate cancer and other disorders, head across to our social media pages.
The Doctor's Journal was brought to you by O Snacks and Medical Associates Hospital.